Hey everybody, welcome back. Let's go through the anticholinergic drugs along with some poisons and the treatments. So, a pretty interesting topic today. Okay, so antimuscarinic side effects, well, the most important one you got to be really like paying attention to is the atropine fever. So, it's going to be a fever induced by the antimuscarinic drugs and the inhibition of sweating. So the body's not going to be able to cool down. There's going to be more vasodilation, which is called the atropine flush. This can like precede the fever, but this is a bad sign because this can lead to shock. Cycloplegia is going to be the paralysis of the ciliary muscles, and the eyes can't accommodate. So whenever objects are brought closer to the face, the eye isn't able to constrict the ciliary muscle in order to focus. You can do this test with also with like a light. So this could also be a pupil reflex. In a person taking a lot of muscarinic side effects, their eyes are going to be permanently dilated. So, like I said, it's a mydriatic, so it dilates the pupil. And simple, it stimulates the alpha 1 receptors, or it blocks the receptor. So like either or. It blocks a different receptor, not the alpha 1 receptors. The parasympathoplegic effects is that it reduces the effects of this parasympathetic nerve stimulation. So the eyes aren't going to be able to dilate. There's going to be problems with constipation and urine retention. Okay, so what is atropine made from? It's actually like a form of it is made in belladonna. So if you drop this into your eyes, the eyes will dilate. So it's a form of it is used in like ocular medication. It's also found in Jimson weed or Jamestown weed. I don't know. These are some images I put in, but I just wouldn't be eating or touching plants out in the wild. The same kind of source, different source, but the same kind of like molecule is going to be made from both belladonna and Jimson weed. It's hyoscyalamine, while in henbane, it's actually used to make scopolamine, which is a pretty well-known medication. And the molecule is hyoscyalamine. Okay, so hexamethonium, mecamylamine, and trimethophan is all used to treat hypertension by blocking the nicotinic receptors. So these are going to be ganglionic blockers. So it's not really used anymore. There are too many like really important side effects because see how high or how early in the action potential, like in the cascade, it blocks. So as a historic point of view, in a test taker point of view, these are important to know, but in a clinical practice, nobody really uses ganglionic blockers. So nicotine is special because in high dose, it's used as a ganglionic blocker, but in low doses, it's actually a stimulant. So an example of a neuromuscular blocker is succinylcholine, and it stops depolarizing. And D-tubocurarine is non-depolarizing, so it's not going to let the cell depolarize at all. This is actually used in anesthesia. So this is curare. Atropine is a central nervous system stimulant at low doses, while hyoscine is a depressant. So here you go. It's a ganglionic blocker. Blocks before the postganglionic neuron, so it's going to prevent epinephrine being released, norepinephrine, acetylcholine. So it's going to block the effects on the effector organs. Okay, so there are a bunch of different antagonists. One would be the natural alkaloids. These are important to know. Atropine and hyoscine or scopolamine. We make it now, like semi-synthetic. So those would be the atropine methylnitrate, hyoscine butyl bromide, ipratropium bromide, tropium bromide. But the important one to know is the hyoscine, scopolamine, atropine, and the synthetic compounds. Oh, these are the important ones. So this is using ocular medication. Oops, sorry. Nope, it's going somewhere. This way. Okay, sorry. So topamide and cyclopentolate will help dilate the eyes. Antisecretory, antispasmodic. So these are used in seizure disorders. They're usually quaternary compounds. An example would be glycopyrrolate. Tertiary amines, so dicycloamine, pienzapine, telemzepine. So with the end with PINE, these are all like depressants. They're also used to treat Parkinson's disease. We use trihexyl phenoldiol, bipyridine, and benztropine. Okay, so in the eye, when the CNS is stimulated, remember, it's going to constrict, but atropine is going to block the CNS stimulation. It's going to depress all these systems. So in the eye, it's going to relax the iris, relax the ciliary muscle, allow the dilation. In the heart, there is no significant effect on the vasculature, so there's no vasodilation, but it will block the vagal input. So it's going to block the vagus nerve, block the parasympathetics, and increase the heart and the AV conduction. So it's going to increase the heart rate. In the respiratory system, it's going to dilate the bronchi. And in GI, it's going to kind of do the opposite. So it's going to relax the detrusor muscle of the bladder. And remember, the detrusor has to contract in order to urinate, and the somatic muscle, the skeletal muscle, has to relax. So kind of keep that in your mind. It will inhibit gastric acid secretion, and all of this, it's due to blocking the cholinergic overactivity in the basal ganglia. It's also important because you can use it to treat motion sickness. It suppresses the M2 receptor in the SA nodes. That's what blocks the vagal input and increases the AV conduction. And the signs of atropine overdose is palpitation, remember, from the heart, dryness, dilation of the eyes, but more importantly, delirium, respiratory depression, and coma. Okay. So at low doses, atropine will block the M1 receptors in the parasympathetic ganglion, and it's going to start bradycardia. So at first, it's going to start bradycardia because of the inhibition of the SA node. But in higher doses, it will switch and block M2 receptors. So with M2 receptors, it's going to bind to G protein, and then the CAMP will be decreased, and then chronotropy and dromotropy will decrease at first, but once it blocks the M2 receptor, it's going to be different. It's going to lead to the tachycardia. So indirect choline drug, so you apply it topically, it's not going to have an effect on the vessels because the vessels don't have any direct connection to the cholinergic drugs or cholinergic nerve. So this has to be either inhaled, which is not common, droplets in your eyes, or IV. Okay, so more effects. Like I said, constipation, bronchodilation, secretion inhibited, it's harder to pee, decreased secretions in the stomach, atropine fever is what we need to be watching out for. There could be dermatitis, conjunctivitis, and the medications that you need to be aware of that can cause the acute atropine intoxication are the TCAs, the phenothiazines, and antihistamines. Okay, so uses. Hyoscine butyl bromide, you use it to decrease the spastic conditions of the GI tract. I, Epitrinium bromide you use to dilate the lungs, or the bronchi, sorry. And these are more effective in COPD versus asthma because the lungs have a higher vagal tone, and this is really affecting the vagal tone of the bronchi. Side effects: dryness of the mouth. Tiotropium bromide is going to be similar to ipratropium bromide, but it lasts longer and it has a higher bronchial selectivity, so it was really good for COPD. Why isn't it used as much? It's more expensive. That's the way it is. Glycopyrrolate is potent and it's a very fast acting without the central effects, so it's not going to lead to delirium or coma. And it's used in pre-anesthesia, so it's a little bit too potent. Dicyclomine is a direct smooth muscle relaxant and a weak anticholinergic antispasmodic action. So it's more used for constipation, anti-vomiting, motion sickness, also people with very painful periods because of the contraction of the uterus. Pixibutinin, we don't use as much in the field, but it has a pretty high affinity for receptors in the urinary bladder and salivary glands, so it's going to relax the urine. It's going to contract the detrusor muscle. It's going to help with nocturia. It's going to help with spastic bladder, but it will dry out your mouth. Oxybutinin, same kind of thing. It's going to treat for, this is the one that we really use in the field, but it will be used to treat the urinary incontinence, thanks to the receptors in the bladder, injuries to the pudendal nerves that control the bladder, and like I said, bedwetting. Drotaverine is a non-anticholinergic antispasmodic, so we're going to treat conditions that have spasticity, so internal or intestinal, biliary, and renal colic, IBS, uterine spasm, and that works by inhibiting PDE4 to increase the CGAMP and the CAMP. Okay, so we're used, once again, anti-secretory pre-anesthesia medicine to prevent the reflex laryngospasm. If the larynx has spasm during the anesthesia, the tongue can roll backwards, the person can basically asphyxiate, and with the CNS depression, the patient is able to compensate for these, right? So if your tongue goes backwards or your larynx spazzes and you are conscious, you're going to cough in order to kind of right yourself, but somebody under anesthesia is not going to be able to do that. So pyrenzapine, telenzapine are going to decrease hydrochloride acid and pepsin secretion, and it's also antispasmodic. So atropine methylnitrate, dicyclomine treats colic. Iopramide, diphenolsilate, and atropine will treat the nervous and drug-induced diarrhea along with functional diarrhea. Oxybutinin, once again, and flavonate will treat the spastic bladder, neurogenic bladder, etc., etc. Ipratropium bromide and tiotropium bromide will treat COPD as a prophylaxis, and you use it with the beta agonist in the acute exacerbation of the asthma. Okay, tropicamide is going to be used to test the error of refraction. So you want to see the error of refraction. For a normal person, go straight back. There's going to be differences if you're nearsighted or farsighted, but in particular, you want to note the angle of refraction to see if it's changed due to glaucoma. So phenylphrin is going to be used in fundoscopy. Basically, it's going to dilate the eye. It's going to produce only mydriasis, so you can look straight to the optic cup. see the arteries, see if any of them have dilated, burst, or have had neovascularization, and to see the macula. Homoatropine is used to rest the intraocular muscles and prevent the painful spasms. And when used, pilocarpine, alternatively, it prevents the adhesions between the iris and the interior surface of the lens. So after trauma, after surgery, you don't want the iris and the lens to adhere. Okay, so atropine is going to be used to treat the sinus bradycardia and temporarily and reverse the atrioventricular nodal blocks. This is not used for a significant amount of time due to all of the side effects that we already listed. Hyoscine transdermal, you actually can use that to prevent seasickness. It's lipophilic. Benztropine, benzhexol, and piperidine are going to be used to treat the drug-induced Parkinsonism. So the drug-induced Parkinsonian syndrome is not true Parkinsonium. Is used because of too many anticholinergic medication it's taken. Atropine is also used to treat organophosphate or carbamate poisoning and in early mushroom poisoning. It's very important. Neostigmine is going to be used to treat myasthenia gravis, but atropine is given to block the side effects of the neostigmine. Neostigmine and atropine together are used to treat decurarization and the cobra venom. Decurarization is when you take the patient off of curare too fast, and then there's going to be a rebound effect. Okay, so once again, in an overdose of atropine, you got to give them pheostigmine and mechanical ventilation. You put them in a dark room to rest the eyes and ice bags to cool down the fever. You also give diazepam for the convulsion. So if you catch it early, you can try to give them a gastric lavage with etanic acid in order to prevent absorption. However, this is contraindicated in patients with basically glaucoma or early onset glaucoma. And males with prostatic hyperplasia can have an aggravation of the urinary retention and difficulty in urination. So the anticholinergic drugs, whenever there's an overdose, these are the symptoms. So you're going to be mad as a hatter. There's going to be altered mental status, blind as a bat, thanks to the overdilation of the eyes, red as a beet, hot as a hare, and dry as a bone. Okay, so that's it for now. Thank you for your attention, and good luck studying.